And we love our children. We love our children enough to advocate for them, for their safety. And so we join Superintendent House in saying to the parents of HISD, let's all mask our children up to keep them safe and keep their families safe and keep our community safe. We encourage the parents in HISD and all districts to advocate for your children. That's your right. In fact, it's your responsibility. Say to the governor and all public officials, including superintendents and principals and school boards, masking mandates is the least we can do to protect our children. I'll say that again. That's the least we can do. Let's please keep our children safe. At this time, I'm going to ask Dr. Joseph Gaff, who is a part of our executive committee, a medical doctor and an infectious disease specialist here in Houston, to give us his remarks from his perspective as a health professional, medical professional. Dr. Gaff.
Thank you, Bishop, and thank you all for coming out today. I'm an infectious disease specialist, and I'm the executive committee of the NAACP, and we stand again in solidarity with Mr. House and the school district with the mask mandate for the schools. In our community, we're having another wave of a pandemic with COVID-19 Delta. This Delta virus is different than the one we have dealt with before. This particular Delta virus is much more contagious and is affecting our community. So as our children go back to school, it is imperative that we put them in a position to be safe. And what does it take to do that? It's actually very simple. For those 12 years of age and older, they need to have on them their life vest. Their life vest is this vaccine. This vaccine for people 12 and older will protect them from getting this particular infection. Everyone 12 and older is eligible for it. Now, what's important about the Delta virus is it takes 2 shots of the vaccine to be protective. And so it will take 2 to 4 weeks after your second shot to be protected. So those of you that have not gotten a shot now, you need to do it now, because it's going to take 6 to 8 weeks for you to be protected as we're going to the schools. That means because of that, we need to also have our shields on. This is our shield. These 2 things will help our community and our children stay safe. This shield or this mask will help to prevent the transmission of the COVID-19 virus in our schools. The theme I want to say is we want to have a mask to mask. We want people mask to mask in our schools. We want the children over 12 years of age to be vaccinated and masked, but we want everyone encountering those kids, teachers, the person in the cafeteria, the person cleaning up, to also be mask to mask. And I would ask the principals in the schools that no matter what you're hearing from anybody else, do that in your schools. At the end of the day, our parents and our principals at the individual schools are responsible for what happens in the school. So if it's not going the way you need to, it's our community responsibility to go to the PTA meetings and say, we want that to happen. Okay, period, the end. Because at the end of the day, we pay taxes. Those are our schools. And it's our responsibility at the end of the day if we don't have people protected to do so. For children under the age of 12, unfortunately, they are not eligible for the vaccine. So it's imperative that children under the age of 12 going back to school put their safety shields on, and the principals in the school put the life vest on for the people that are going to be interacting with our children. Period, the end. Mask to mask below the age of 12. Say, my kids don't want to do it. Your parents, okay? You're responsible for your children.
Right.
Make it fun. Make it an adventure. People worry about what kind of tennis shoes they have coming in. What kind of mask you wearing today? Oh, man, I got one better than you. Well, you come back with another. Make it fun and make it happen. Because what we're seeing now are children as young as 7 weeks in the intensive care unit with COVID-19 infection. 7 weeks. And what I'm seeing also is children that are not necessarily sick but getting COVID, bringing them in to the house and infecting all. I have one family where 9 people were infected by one child. 2 of them are dead now. The other ones are sick. That doesn't have to happen. So as the children go back to school, and they need to get back to school because they've been away for so long, we need the life vest, we need the shields, and we need our people to do that. So we stand in solidarity. Please do this. The vaccines are available. They're free. They're easy to get. And this is not hard to get either. Please do so we can protect our communities and get this COVID-19 virus and this pandemic under control. Thank you for your attention.
Thank you, Dr. Gaff. As we make ready to bring our next couple of speakers, let me just say this. We're going to start a campaign through our education committee, through our faith community as well. Love me, mask me. Love me, mask me. We want parents to know that when you mask your child, you're loving your child. Love me, mask me, because that's what this is really all about. And I'm trying not to be too passionate, Ms. Galloway, but the governor's order is a death sentence. It's a death sentence. When Dr. Gaff talked about those children who died, we don't want to see that happen again and again and again simply because we refuse to mask up our children. And so the governor is going to have to take responsibility for that. Love me, mask me. We're going to start that campaign throughout our city, throughout our region, because that's what this is all about. At this time, I want to bring my friend Johnny Mata. He's a leader on multiple levels in our community. We want him to speak at this time. Johnny Mata.
Thank you. Thank you. I'm honored to be before you and this incredible leaders that we have. The Greater Houston Coalition for Justice is an umbrella group of various civil rights and advocate groups. We stand in solidarity with NAACP for the protection of all children and strongly support the call for the superintendent's message. And his message is to save the children. In Houston and in Texas, we're beyond a crisis. We're in a catastrophic stage and must take it the most aggressive action to protect our children. When it comes to the protection of all school children, there's no room for political grandstanding, rather a time for mobilization of all resources and for the children and mankind. Again, we stand with the NAACP, which is a member of the coalition, and I want to echo that we want to support all school districts because the number of children at risk, and we ask the governor to rescind his death warrant that he has on masks.
Thank you, Mr. Johnny Mata, always for your leadership and for your support and for the solidarity. At this time, Daniel Science is going to come representing LULAC, Council number 60. We appreciate him being here on behalf of LULAC today. Come on, Daniel.
Thank you. Ladies and gentlemen, I'm here on behalf of LULAC 60 to stand with the NAACP to show our united force in supporting Superintendent House in his decision to move forward with a mask mandate. Ladies and gentlemen, 60% of our HISD students are Latinos. These students are more than likely not vaccinated, and they need to be supported and encouraged to wear their masks. Along with that, as mentioned before, many of them go back home to very large families where they have brothers and sisters, mothers and fathers who are at risk when those students are at risk. Many people do not know that HISD is one of the largest employers in the city of Houston, with over 20,000 employees. So looking to our superintendent to make this decision is our way of saying that we're there for the employees as well. We want to help support them and their families. So we're here again with LULAC 60 to support the NAACP in helping our superintendent move forward with the executive mandate to wear a mask. Thank you.
Thank you, Daniel, and we certainly appreciate LULAC's support. The point that's being driven home is that our children connect with too many others in our communities. Imagine these children, many of them come home not only to their parents, but their grandparents, their elderly grandparents, their sick and unhealthy grandparents, aunts and uncles. This is very, very important, and we're really urging that the governor would rescind his executive order, but that every superintendent would immediately, not wait for something else to happen, not wait until their funerals, make this mask wearing mandatory now. And as Dr. Gathner said, we're urging all parents to get your children vaccinated as soon as possible. At this time is Mabel Caleb, who is the chair of our education committee here at the NAACP, will have words.
Thank you, President Dixon. On Monday, August the 9th, the NAACP Houston Branch Education Committee met, and we reached consensus that we will stand in support of our superintendent for Houston, Dr. House, mandating masking for our children and the employees of the district. We must stand in solidarity with our superintendent and all superintendents throughout the Houston area to mask our children and our employees in order to provide a safe environment for them. Remember, one life lost, just one life lost is too many.
Yes.
So let's love our children. Let's mask up. Let's listen to what Dr. Ganson said and our president, along with our other supporters that are here. We love our children, so let's mask up. One life lost is too many.
Yes.
Thank you.
Thank you. Again, we're grateful to have Mr. Leonard James, our national board member, who's here. We've recognized him and all of those who are present at this time. I want to ask, and of course, Carol Galloway is a former HISD board member. I know you would have been supporting this as well. I want to mention that we've spoken with the president of the board, Dr. Patricia Allen, and she knows and believes the board would give their total support to this mandate as well in their meeting this evening, and we're grateful to God for that. I've spoken with Dr. House this morning. He's grateful for the NAACP and all these organizations coming out in support of the mask mandate as well. A number of pastors are on board, religious community leaders are on board with this mask mandate. We believe that hopefully this will reach our governor's heart and our governor's ears. At this time, we're going to ask Mr. Mata to translate our position in Spanish for the Spanish-speaking audience. I was going to do it myself, but he can do it better.
He could probably do a better job. For some of you who don't know what a pocho is, that's a Mexican-American that speaks half English and half Spanish. But I will do my best. El NAACP ha convenido esta rueda de prensa para apoyar el superintendente de HISD, el doctor que ha implementado la póliza que los niños usen máscaras. Estamos en un tiempo muy peligroso y queremos mandar el mensaje a todos los padres y de los hijos que manden a la escuela a los niños con máscaras. El gobernador de Texas ha mandado una orden en contra de máscaras. Ahorita no hay tiempo para jugar el juego de política, porque este caso es muy serio y tiene en peligro las vidas de nuestros niños, los trabajadores en las escuelas, las maestras, y este grupo estamos apoyando al superintendente Mallard, también a todos los distritos de las escuelas que están en la vecindad de Houston y pueblos circunvecinos, y le dijimos al gobernador de Texas que es tiempo que retire la orden, que es una orden de muerte sobre los niños de todas razas. No hay tiempo de jugar política, hay tiempo de todos nosotros abrazar los esfuerzos para proteger los niños y toda la humanidad, no nomás de Texas, pero Estados Unidos mundial. Gracias.
Thank you very much, Mr. Mata. At this time, if there are questions from the media, we would entertain them at this point.
You mentioned one campaign about loved ones, max them, something like that. Can you give us more information about this campaign?
Yes, we will actually produce PSAs with this theme, Love Me, Mask Me. We will send out videos on social media, Love Me, Mask Me. Churches will broadcast it through their networks, Love Me, Mask Me. We'll ask all of our community partners, we've got many, to also join the same campaign. This is not about just the NAACP, but we're going to ask every community-based organization to support this campaign so that parents will get the message, so that public officials will join with this message. And hopefully we can spread this throughout the state. We have a network throughout the state. I've also spoken with our state president, Mr. Gary Bledsoe, who could not be present today, but he supports our statement, supports our position. And we're certain that all the NAACP branches across the state will pick up the theme as well. Love Me, Mask Me must become a mantra that unites all of us in an effort to support our children and save our children. As has been mentioned, this is not political, it's moral. When you start talking about health and life and death, this is a moral issue, not a political issue, and we must elevate it to that level.
When this campaign is going to be started?
Immediately you'll start seeing it and hearing it in the next 24 hours, and you'll see the postings and you'll see the press releases coming out, Love Me, Mask Me.
What does it mean to be together, our organizations, churches, NAACP, LULAC, to be together against this, against the opportunity just to have everyone masked?
Yes, and it's not just for children. I think we need to understand that we put our children at risk with irresponsible adult behavior. Dr. Gaff has talked about that quite a bit, and I know he might want to have another word about it, because parents and adults need to realize that if you're not vaccinated, if you're not wearing your mask, when you come home to those children that you say you really love, you're putting those very children at risk. And then those children will put other children at risk. This is a crisis of catastrophic proportion, as Johnny Motto mentioned earlier, and we've got to treat it like that. We cannot be casual when it's a life and death matter.
So yesterday I interviewed a parent who's dropping off her children at a high school. And we talked to her about her protection, how she feel about the mask mandate that spring, that they're mandating all the kids and teachers and everybody on campus need to wear a mask. We did also ask her, are you vaccinated? She said, no, I don't trust her. I don't trust that actor. She is of African-American descent, which surprised me because the majority of the school is Hispanic and African-American, but she didn't want to. She would send her kids to school, wear their masks, but she was like, I'm not too sure about that vaccination. How do you get that through people's head? To tell them it's for their protection and for others, but people just don't trust it.
I'm going to give a quick word and then allow Dr. Gath to respond to that as well from his professional perspective. I will just say this. We are saying to parents in our churches throughout our community and even as a branch, listen, we took the polio vaccination, the flu vaccination. We took all vaccinations as necessary. I'm still here. I'm hoping that we can demythologize that concern, help people to understand that this is not a time to be paranoid. I want the doctor to speak to it, but listen, vaccinations save lives. That's the bottom line, and Dr. Gath will put that into medical terms.
Add on to that, she did say, my kids are vaccinated, but I hear other kids getting sick after they're vaccinated, so why should I send them to school if they're going to get sick anyways after they're vaccinated? There is that myth too. So.
There is.
Let me make 2 points. The first point is in the Houston-Harris County area, only 45% of people are fully vaccinated, which is all the more reason why you have to wear a mask, because 1 out of 2 people you're standing next to is at risk for spreading COVID. So the first thing you need to tell her is put your mask on and put your mask on your kids, and then we can have a conversation. That is why the mask, you prove the point about why the mask is so important, because we don't vaccinate enough people, and even when we have, we're still less than 50%. So that's the first message. The second message is that there are a large number of people that have illogical reasons for not being vaccinated. And my God in heaven, I talk to them every single day, and it's hard to make a logical argument to someone that is having an illogical response. And that is why we need our political leaders to walk up there and say, you need to do this. Our governors at the states need to do this. Everyone needs to line up and be on TV every 10 minutes to say vaccine, 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 all the way from our former president all the way down. And until that message gets through, we're not going to be able to fight the illogical things that are on the media at this point in time. We're doing it hand to hand as we get. We're doing our best, but that is the proof of why the masking is so important until we're able to overcome exactly what you've said. I want to make one other thing to show you the proof that this information is coming out next week. They did a study at Duke University at their schools. If there's 95% of the kids in the schools that are wearing masks 95% of the time, the transmission rate in those schools was less than 1%. Less than 1%. For the schools that didn't do that, the transmission rate was 13% or higher. And so we now actually have proof that the masks in the schools work, which is why, again, it's so important to do it. That is the medicine for the people that aren't vaccinated to be able to make sure we stop the spread until that happens. A very important concept that needs to be brought out to the community.
I think it's important, too, to recognize that not all elected officials are not on board. We're grateful to have Sheila Jackson-Lee's office represented today. We appreciate that very much. And I did speak to the Congresswoman about this issue. She is out on the front lines, as we know, trying to get people vaccinated, giving away masks. She's on the stump of that. Commissioner Rodney Ellis is doing the very same thing. I spoke with him. And I spoke with Harris County Judge Hidalgo this morning as well. She is celebrating the fact that the NAACP and these organizations are out here on today. I think pretty soon, Dr. Gath, as you just indicated, you're going to see a growing front line of elected officials, faith leaders, community-based organizational leaders standing together every day calling for vaccinations. And I, to my surprise and dismay, I overheard a school nurse telling people that the vaccinations and the masking was not necessary. This is the kind of bad information that's coming from people of influence. And she was convincing parents. And I simply chimed in to say, are you going to believe a school nurse Or are you going to believe the CDC and the doctors and the scientists at the highest levels? We have got to, y'all, stop politicizing this and trivializing this, because the funerals are real. The hospital beds are filled. The medical professionals are asking for help, help, help. And we still can't get enough medical health professionals at work here in Houston, Harris County and in the state of Texas. So this is a serious issue. Love me, mask me, and we will make sure that that campaign is publicized throughout our region. We appreciate the press helping us to get the word out. It will save the lives of our children. Let me say thank you all very much for coming. We appreciate you, and God bless Houston.
Brother, thank you so much for giving me the opportunity to speak.
Thank you for
Appreciate
coming.
it.
Thank
Yes,
you
sir.
for coming. Thank you.
Maybe I'm going to be following up with you. Okay? You'll see my contact info via email.
Text me, too.
Will do.
Quick shot of that. It's the model number, so get this. DYN2.
Yes.
Get that.
I love it.
Good to see you. Thank you so much. Mr. Mata, thank you so much. Appreciate it. Thank you.
Okay. I'll do that.
Okay?
Thank you. Appreciate it.
What is it?
832-446-8647.
We went to get some donuts.
I know, it's did you tell me?
You're right.
Is the place closed or they just shut
It
down?
was closed. They would tell you so long.
Thank you.
Yes.
Oh, thank you, Olivia. Thanks.
Thank you, ma'am.
Absolutely, darling. They seeing you.
Thank you so much. I really appreciate it.
Tell your mom we said hi.
I will. Yes, ma'am, will do.
Good job.
Mr. Mata, thank you so much.
How'd you do? All right? Yeah, I could tell she was like pointing up. Their audio is bad, so I was like, move up, move up. Then I had to test to see, make sure that you weren't wide. If you were, then we're. But yeah, it worked out as long as she can get the audio. I just hate it that she's trying to transmit and it sucks. Well, at least you got Johnny to talk in Spanish for you.
Right?
I was like, oh shit, I don't know, man. I don't know if you're gonna get it. And then Johnny shows up. Like,
Very good.
Johnny worked out. Thank you again for the water, sir. Appreciate it.
Thanks a lot.
Absolutely. Thank you.
Suppose that channel 2 went to another.
Yeah, in Fort Bend County, I think. Car theft ring. It could have been a car theft ring or something like that.
They went to the red, emergency. Red color.
Red.
Yeah, in Fort Bend.
Oh, really?
Legit, they just changed orange to red.
Oh, really?
Yeah.
Oh, KT. Yesterday.
Oh, that was yesterday then.
Yeah.